laboratory capacity. They've gutted the food safety research, and they're now spending massively in public opinion research. So that's an indication that there's something wrong. It's not that they're not spending money, but they're not spending money to be an independent scientific watchdog over industry products.
Now, we've had on this program before, actually a couple of times in the last couple of years, the so-called whistleblowers in Health Canada, Shiv Chopra and Margaret Hayden, those people talking about what happened to them, and that was all around the bovine growth hormone controversy. Is that particular case for you and the coalition one that is kind of like that was the alarm bell, that there were things being pushed through the system that we weren't being told everything about?
That was certainly a major international incident because, as you know, the Senate Agriculture Committee televised those hearings and had the scientists appear as expert witnesses and promised them protection, by the way. And so they came to Parliament and exposed real problems in the drug regulatory system, and were promised protection, and then were fired. Yeah. Now, there's some legal experts that have retired from the House of Commons that say that's a contempt of Parliament, to fire these people. But it's true, that was a really kind of major warning signal. That was the canary in the mine. Yeah. And we think, as a health coalition, as public interest groups, we have to protect the people who stand up to uphold the law. Because if we don't protect them, who's going to protect us from Health Canada?
One of the arguments that's made by those on the other side of this argument is that, listen, everything has risks attached to it. And we would never make any advances if the precautionary principle was applied that stringently. That if there was any chance that something had a risk attached to it and it wasn't allowed on the market because of that, we'd still be back, in the 17 or 1800s.
That's a misrepresentation of the precautionary principle. The precautionary principle actually is more scientifically rigorous than the risk management regime, because it looks at all the options. It looks at alternatives to this technology or to this. For example, RBST. This is a growth promoter for milk when we have a massive oversupply of milk. So a precautionary principle would say, well, do we need this? What's the alternatives to RBST? And also, precautionary approach would say, where's the human health data? Because if there's harm, it's irreversible. So a precautionary approach to that, it's true. In that case, it would say we don't need this. But it's not to say there wouldn't be innovation. It's just that it would be proportionate to the level of hazard. So not all risks are the same. So it wouldn't be an impossible standard that you'd have to meet. Right. But you asked the question of what's really driving this, and I think it's biotechnology. The Standing Committee on Smart Regulation already identified we've got to get this law changed at Health Canada in order to pave the way for biotechnology, because they want to make money off biotechnology without doing the safety research.
So we're talking, when you talk about biotechnology, you're talking about genetically modified foods and what other sorts of things?
Biopharmaceuticals, cloning, xenotransplantation, a lot of scary technology. And if we change the Food and Drug Act, there'd be no requirement to demonstrate the safety of the technology. It's presumed safe until you fall over dead.
Yeah. Now, we do have a visual aid here that we'll use, because I think that there'll probably be some people listening and going, well, he's paranoid. Yeah. So you made an access, or I guess it was the coalition, made an access to information request.
Yeah, I mean, the central problem at Health Canada is secrecy. Now, if they were working in the public interest and really protecting safety, they'd want to show you what they're doing. Now, we filed a request just to ask them what the policy was on biotechnology at Health Canada, because they're a regulator. They're not supposed to promote the technology. So here's what we got back from them.
Yeah, here, I'll put this up the camera. So the question basically was what?
The question was, what is the policy of the various departments on biotechnology?
Okay, and here's the answer, if we can get a shot of that. There is no, you would have thought you were at. Here's another page.
There's 2 pages.
There's another page of the like sending an access to information request to CSIS. I mean,
we weren't asking for trade secrets. We were asking for what the policy was on biotechnology. No, so it's a total black box. Now, what's really disturbing is it's a culture of secrecy that's risking your life. That's a really bad combination.
You mentioned the Creever inquiry a little while ago, and Justice Creever. I spent some time in the early 90s, a brief period of time, working behind the scenes at the Red Cross for about a year. It happened to be just before the Creever inquiry was starting, and I was made privy to a lot of the discussion that was going back and forth at the time, and sort of all sides of the argument. One of the things that struck me at the time, and I've often asked this in these situations too, that it appears to me that in some cases there are these horrific trade-offs that have to be made by the professionals that are in this area. And the hepatitis C one always struck me as being one of those. That those people who got infected through the blood system with hepatitis C, which is a horrible thing to have happen to you, always said, well, you know, this was done intentionally. There was this test in the States that could have, you know, let them know. But when you started looking at the time, I was looking at it strictly as a you know, an unbiased observer in this thing. That the argument that some people were using was, well, look at this test, because it was a negative test and not a positive test. In other words, it wouldn't tell you if hep C was there. It was sort of like looking at a black hole. You could see things around it, but you're not really sure. That the worry then by the health professionals at the time, on the hep C thing only I'm talking about here, was that there might be so many false positives using this test that the impact on the blood donor system would be so significant that people would lose lives because there wouldn't be any blood for transfusions, and that might be even worse than the risk they were running with the other stuff. So you're looking at basically a lose-lose situation. Those things happen sometime in these systems, don't they? It's
true that in a lot of these areas you're dealing with balancing things. But in the blood situation, I don't think Canadians realize this, that there was the blood committee, minutes of all the meetings were stored at Health Canada, and they were all destroyed.
Yes.
Right? There's criminal wrongdoing in the blood scandal. It's not just legitimate weighing of risk.
Right.
Right? There was deliberate decisions to distribute tainted product. They knew was tainted because companies didn't want to dump it.
Yeah. But I mean, in that case, I remember thinking afterwards, well, if a lot of this is motivated by the interest of profits by certain companies, then in the case of the hep C thing, you would have thought that the pressure would have been on them from the companies that made these tests to have these tests done, and then if they were going to accede to other ones, they would have acceded to that, but they didn't. So in fact, the analogy doesn't hold up across the board. In that case, they made a different decision other than one they could have made, and it had tragic consequences, but it could have the other way as well.
Yeah. Well, I mean, in hep C, in terms of the compensation package, there was a huge controversy over that with these artificial dates.
That's right, yes.
And
yes. Well, they did. That was a bad...
That was
they handled that one
They were
badly.
trying to protect liability.
Yeah, yeah. All right, the part of this book is an open letter to the health minister signed by a number of prominent Canadians. Describe what it's asking for. We haven't got much time left here, but basically you want this whole review stopped?
Yeah, we want this, what they're calling health protection transition, stopped. We want to keep the Food and Drug Act and start enforcing it. And we want to really, it needs to be based on the precautionary principle. Risk should be assessed in a broad perspective based on the precautionary principle. And right now, the precautionary principle is at the bottom of the list and will never get activated in this framework. The other thing is we have to end the secrecy. Specifically, we're asking for the data upon which the drugs and the food are approved. In the United States, the data has to be on the website within 10 weeks of a drug being approved. And that's really important because doctors can find out what the raw data is on this drug and what the potential negative reactions are. Take Celebrex. Celebrex is on the FDA website. Right?
Right.
In
with all
Canada,
the information on it.
All the raw data, not just the reviewer's report. Canada, the raw data is secret. And the reviewer's report, it takes you about 6 to 8 months to get it. It's all blacked out, the essential information. This is extremely dangerous. It's costing people's lives, and it means that the drug reviewers or the regulators are totally unaccountable for their decisions.
Okay. And has there been any response yet from government about this, from our new health minister or anything like that?
Not the new minister.
No.
We're still trying to meet him but of course in the meantime we're working hard with members of the health committee and members of caucus and members of parliament, including opposition parties, to alert them to what's coming in the pipeline.
Okay. Good of you to do this. Thanks very much.
Thanks, Ken.